anterior rotation muscle energy technique is used to treat patients that have a posterior nominate rotation. Some exam findings that would indicate this type of rotation are a positive result of the supine to long sit test, where the affected leg appears short in supine and longer in sitting, and asymmetries of the bony landmarks of the pelvis. A posterior rotation would cause the ASIS to feel higher and the PSIS lower relative to the other side. The absolute and relative contraindications for this technique are fracture, severe strain or sprain, osteoporosis, or a patient that is unable to follow the instructions.
To perform this technique, patients should assume a prone position on the table. As the therapist, be sure to position the table to a comfortable height to promote good body mechanics and expose the area. The therapist should lift the patient's thigh off of the treatment table, placing the patient's hip into slight extension and flexing the knee to 90 degrees. The other hand should be positioned over the posterior surface of the iliac crest to stabilize. Instruct the patient to perform an isometric contraction into your hand and hold for 5 seconds. Have the patient relax and then pull their thigh up to increase hip extension. You should repeat this 2 to 3 times. This will help to guide the pelvis into anterior rotation as the rectus femoris contracts and pulls it on its attachment to the AIIS.
After performing this technique, you should recheck the landmarks and the supine to long sit test previously mentioned to see if the technique was effective. If not, you can reperform the technique for another attempt. If the technique was successful, lumbopelvic strengthening should be performed to maintain this corrected position.